Thank you.
Thank you. That's a very hard act to follow. So my role is I'm one of the haematology nurses at the Royal Melbourne Hospital, but I actually have patients right throughout the state of Victoria, and I actually also have some in the Northern Territory as well. And his parents were with me today, which was quite entertaining. Is it the green bus?
Just thought I'd join in and
Oh yeah, thank you. And I'd just like to say thank you to everybody. It's always good to see some people's faces. And also, would you believe even a patient came up to me that I've been texting, as she said, Rebecca, you've been texting for over 10 years and I have never met her. And how rude is that? But sometimes when we meet patients, it can be via email, via telephone, via other forms of media, just so that we can actually make a contact. So my whole role is to encourage you to be engaged in your healthcare. Healthcare, you need to own it. So it's really important that you are involved in the decision-making of any treatment, of anything that's going, and by doing that, you need to have a proper understanding. So what is shared decision-making? It's a collaborative approach. It's a shared approach between you and your healthcare professional. You're going to bring your life experiences and your ambitions and what you might be planning, whether it's maybe just a family holiday. How are you going to manage your ITP on that holiday? And taking on the expertise that your health professionals have so that you can actually take that information and together we'll try and work out a plan or a goal that will actually help you achieve what you want to achieve. So it's a form of two-way communication. I haven't got my glasses on, which is not good. So patients, as they share their experiences. So, as I said, I had a patient recently. I always like to tell stories with cases that I've looked after. I had a chap that had been diagnosed with ITP like 15 years ago. And then all of a sudden he relapses and he's like, oh my God, we're going to Greece in 3 months. This is going to affect our holiday. I said, no. Let's leave it to the last minute. We will manage. We'll get you on to that holiday. We will absolutely aim to do that. He said, no, peace of mind. I don't want to. I will rebook it and I'll go in 6 months' time. Not a problem. So we managed his recent relapse of his ITP and we were able then to get him onto that trip safely and actually have a plan for while he was overseas. I've had patients who have been overseas and collaborative approach again, they have a relapse while they're overseas. Somebody was in Serbia and I'm getting these emails, Rebecca, our platelets have dropped. What do we do? They've taken drug with them. They know what they are and they have a plan. And there's always important that you always have a shared plan to make you achieve your goals, which is what the whole aim is. What the doctors are going to bring to your partner or your medical profession, your medical treatment is evidence-based treatment. So there are some people that are going to have really tricky disease and some of those diseases are more challenging than others to actually try and achieve some of your remissions. So you need to be open to thoughts of like clinical trials if somebody's going to do that. So taking all that information away so that you can all make informed decisions on if that treatment suits you, if you want to be interested in that trial, do you want more information? So they're the things that you have to think about. The key elements is what I say is about, we call it empowerment. You actually have to be engaged in your healthcare. You can't just expect us to hold your hands all the time because unfortunately you're an important one, but I can tell you that I have an ITP registry. I have 300 people just in the state of Victoria that are on my books. So it's important that you being that one, that you are actually also proactive in your treatment. Whether that's a simple, you've had a blood test and you need to know your result, then let us know. I'll chase those results because then we can actually have a plan for you. You need to actually also be aware of other treatments that it might be out there and, have those conversations. When you get told a diagnosis of ITP or if you have got chronic ITP, know what maybe might be the next treatment option. Or can I get off this drug? Is there a chance that you can wean me off this drug? Can I be engaged in taking over that? Because let's face it, nobody wants to take tablets. I have enough trouble remembering to take my vitamin D. God knows if somebody has to be on lifelong medication that they have to take every day. So, if there's a chance that can be explored to wean you off that medication, let's explore it. And all of these things are done in collaboration with you and maybe with your family members as well, because sometimes you can't do these things alone. So what are the benefits? There's an improved understanding of treatment outcomes. There's increased treatment satisfaction. We actually find that when people are actually engaged in their care and in actually having some knowledge about it, there's actually better adherence to your care. So then maybe it's just like getting a regular blood test, maybe it's taking your tablets, maybe it's an alteration in how you take the tablets. We've got patients, I have a patient that's on L-Trombopag or Revelade. It's 1 tablet every 3 weeks. How the hell do you remember to take 1 tablet every 3 weeks? But it's those type of things, and it's about having family around or reminders to help you be engaged in your care. It helps to build the relationship between us. I mean, it's important as well to personalise that treatment. Like I said, 1 tablet every 3 weeks for this one person. And how do we get this patient off this drug eventually? That's a bit tricky because that 1 tablet seems to be doing some good. It empowers you to actually be your own health advocate. It can help to reduce your anxiety and any uncertainty that you have. So if you don't understand something, please ask for clarification. You might not necessarily find that you might have a relationship that you could do maybe with one of those member of your health professional, but there might be another person or another way that you can actually seek out that information. And like everybody said, never hesitate to seek a second opinion. I've had somebody that didn't like me, was the patient that was in Serbia, but that's her issue. Anyway, and as a result of that, they got a different nurse looking after them. That is their choice. And it's a shared choice as well, because it was probably to my benefit as well. But, it's all about being able to have the confidence and to be able to go forward and see what you can do as a team. And it will foster long-term engagement in your healthcare, and it also will enhance your own quality of life. It actually enhances mine too if you're actually involved in your healthcare, because then I'm not stressing at 2 a.m. in the morning that you've actually had that blood test and have taken your medication. So as I said, it's a shared approach, and it's part of the actual Australian national guidelines. And I think I left some leaflets out there. So there's actually national standards now that have been published by the federal government in Australia. And I'm sure that it's the same in New Zealand, Mike and Kylie and Murray. So as we all follow along similar guidelines. So, it's really, really important that everybody actually has the empowerment, that it is full disclosure. You have a right to your notes. You want to be able to have those conversations. And actually, it's really important that you actually have some source, because often you're educating your other health professionals in your team, like your GP, and because sometimes people don't have a regular GP. So think about what's important for you. What are your aims? What are your tips? Are there milestones that you want to get to? Is there that family trip? Is there that wedding that you desperately want to go to, but you want to make sure that you're well and you don't want to take that medication, or how am I going to work it? There are things to plan, and we can all work together as a team. And many a time I've done that for patients. Share decisions about care and treatment choices with your healthcare team, because if you actually share what you want to do or what your aims are, then at least we can help work with you. Identify goals of care that are positive and yet are achievable as well. I'm not going to suggest that if your platelet count is sitting generally around that 20 to 30 mark, I would recommend that you start engaging in contact sports. But if there's a way that you want to do something that is a bit more at risk, then we'll look around to seeing what we can do to help. And also look at maybe what your bleeding risk is. So I have a young chap who's absolutely he'd been treated at the Royal Children's. He's come to us, and when he was at the Royal Children's, they said, you can't do kickboxing. But he's a mad kickboxer. And we just said, well, your platelets normally sit around 50 to 60. Do you usually bleed? No. Have you ever had an injury? No. Well, we're happy for you to do that, but if you do get an injury, you do need to realise that you will bleed, and that you might need to take longer time out for that bleed to heal. So it's, having a shared approach. I had a patient the other day who had a platelet count of 3. Couldn't stay in hospital overnight. Horrified. Hospitals traumatised her. So again, we had a plan. go home, we'll give you some immunoglobulin, come back the next day, we'll do another blood test. So it's about working together. So, medical people aren't trying to be scary, but, it's all about working as a team. So never be afraid to voice it, because at the end of the day, it's your body, it's your life. Understand who will be involved in your care and their roles in helping you. So whether or not it's your nurse, does your nurse chase your blood results? Is your nurse working closely with the haematologist? Is it your primary care physician for people in regional areas? Is your GP helping to chase those blood results? Will your GP tell you how to taper your prednisolone dose if you have a flare of ITP, which sometimes happens with some of our regional patients that I care for? Always understand those things. Be able to access a record of your agreed goals of care and share it with others. So, if you've had to come into hospital, make sure that you get a copy of the discharge summary that you have, so that at least you always have it on your record, but also that you make sure that your GP gets one, because they're really important things. Keep track of your progress towards the goals. So, if there's something that you want to do, have a bit of an idea for it. But then, make sure that, say you're planning something good, but you want to make sure that you're off the steroids beforehand. Is there a way to do a rapid wean? What can we do to do everything safely for you? And remember that goals can always be moved. Nothing is finite, so never be afraid to move the goalposts, because health professionals certainly are never scared to move goalposts. So in summary, you have to be able to own your diagnosis. We're not saying this needs to rule your life, it's just a part of your life for those with chronic ITP. Ask questions, and ask lots of them. As Mel said, she gets patients to bring in a list. I get them to send me an email. I might not get through to it, but if you write it down or send me an email in the middle of the night. Somebody said there's no such thing as a stupid question. Sometimes there is, but that's okay, because we will deal with it, because we've had very strange questions, and I can tell you I've had many, many strange questions. And if you don't understand what's being discussed, please ask. You need to ask, because sometimes we use big words. We don't mean to, but sometimes we just don't think. And it's okay to ask for a second opinion, and I can't stress that enough. For people who are in a regional area, you might not get the opportunity to choose a health professional, but there's nothing ever stopping you either being asked to be referred to a bigger metro hospital, and you can actually be managed as a telehealth patient. And there is nothing wrong with that. You just have to have the courage to do that. And you can actually ask for a second opinion if you don't want to ask your treating haematologist through your GP. Easy enough to do. And look at and discuss the future plans and goals. So who are your resources? Your family, your own healthcare team, different resources that are actually within Australia, such as ITP Australia and New Zealand, government websites. As I said, this is now important, and it's part of our legislation that shared decision making and is part of what is expected in our healthcare professionals, our healthcare facilities. And there are lots of international organisations too. Just always be wary what you look at, because sometimes somebody will say take 3 Chinese herbs and you're cured forever. So make sure that you do go to reputable websites. It really, really is an important thing. So takeaway messages. If you have concerns, seek answers. It's your disease, it's your journey, and it's in partnership with your healthcare team. Your goals can always change depending on treatments available and your life choices. And often you may be the one educating other health professionals, as I said, like your GP or other family and friends as well. So if they've not heard of it, so maybe even have ideas so that you could even direct them to say, oh, well, look at this website. And a set of parents that came up, and I've been managing their son in the Northern Territory. He's stuck in the remote end of Katherine and takes 2 days to get a blood result that goes on a bus overnight from some outback town to Alice Springs to get this result. So he's educating the health professionals that he comes across on a regular basis. Thank you.